I want to bring in Brian Gragnolati. He's president and CEO of Atlantic Health System. It runs 7 hospitals as well as other medical facilities in New Jersey. And Brian, we should first of all note that the doctor I just mentioned did not work in one of your hospitals. But I do want to start by asking, how are your hospitals managing, especially your doctors?
Thank you, Craig, for having us talk about this important issue. You know, our medical professionals are some of the most amazing human beings in the world, and I've had a privilege of working with them for so long. This is a very difficult issue for all to work with, and our thoughts go out to the family of the physician that passed. But I got to tell you, as I talk to our providers, they've not experienced anything like this.
NewJersey.com is reporting that the state health commissioner there in New Jersey said on Wednesday that a surge in cases isn't really expected in New Jersey until the second week of April. How are your hospitals bracing for that surge?
So we are in that process right now. You know, if you follow the train line out of New York City, you get into New Jersey, you get into the market, and we are seeing that doubling of cases and everything that you would expect from that. We've taken care of over 3,000 patients that have tested positive. Today alone in our command center, it was reported we have 600 people in place. But we also recognize that about 20% of those folks are in our ICUs and on ventilators. So making sure that we have the right protective equipment, making sure that we have adequate access to ventilators and the medications we need are critically important. And we are working very hard with the state of New Jersey in a very cooperative way to make sure that not only those of us in northern New Jersey, which is really the epicenter right now in New Jersey, but this will move throughout the entire state, have what we need, but also that we are making sure that the governor, who has been incredibly supportive to our hospitals and doctors and nurses, has the information that he needs to advocate on our behalf.
My colleagues over at Morning Joe talked to the emergency room physician who's working in New York about the patient overload, about the lack of appropriate protective gear, that PPE we've all been talking about. Here's what he said.
The proper use of gear is to switch it out. They're supposed to be disposable in between patients. But now, just for expediency's sake, because patients come in 10, 20, 30 at a time, we can't switch 10 gowns and protective wear within 5 minutes. We have to keep it on, which is, a infectious control risk, but it's a practical problem too.
How concerned are you about that in New Jersey? Is that an issue for your doctors and nurses as well?
So today we have an adequate supply of protective equipment, particularly the N95 masks. But in order to accomplish that, we've had to reuse those after sterilization using a technology of ultraviolet light. The other thing that we have to be aware of is that we have to change the way we care for our patients. And the example that was used in terms of overwhelming emergency departments, that's also happening in critical care units that we're having to adapt and develop in areas like post-anesthesia care areas. So we've done that by creating teams of people who operate differently so that we are trying to address some of the things he mentioned. But make no mistake, protecting our healthcare workers is our top priority.
Those healthcare workers, those doctors, those nurses at your hospitals, how are they holding up?
You know, I had a chance to speak with one of our hospital presidents who is a nurse today. And, again, I started in healthcare as an emergency medical technician. And I know what it's like firsthand to be on a scene. And I know how deeply people care about what they do. And that really is what drives their work each and every day. One of our nurses said to me, "This is what we train for. This is why we are nurses." But it's hard. And the thing that makes it most hard about this, that's unusual from everything else, are two factors that were pointed out to me, and I completely agree with. One is the compartmentalization issue. Oftentimes in healthcare, we deal with very hard things, but we can say, okay, this is what we dealt with, we did the best we could, and go on. This is a very personal issue to everybody. It affects their families, it affects their friends, it affects their loved ones, and it affects themselves. The second thing is isolation. Our caregivers now have to serve as the surrogate family members when these patients are hospitalized. So not only are they caring for the patients the way they've always cared for them, they're doing so in a difficult situation where they are covered and masked, but they're also having to act as a family member, and that makes it very hard. So what we're doing about that is we're trying to help our team members with their activities of daily living that they need, child care and housing and things like that. We're trying to bring supportive mechanisms through our resiliency programs that are led by a great group of our clinicians, and it's called Caring for Our Caregivers. And we're trying to replace what typically had been perhaps a group huddle or a hug after something really bad happened to one where we can work in small groups to talk about that, to get that kind of a sense of camaraderie. Resiliency in healthcare workers is amazing, but this is absolutely testing it.
Well, we so appreciate them. We so appreciate our doctors and our nurses and all of our medical staff who are on the front line of this thing. Brian, thank you so much for your time. I do appreciate you.
And if I could,
any moment now.
Yeah. If I could just make one more comment, please follow the social distancing recommendations. That's the one thing all Americans can do. Thank you.